What are the skill set I need to develop?
Your physiotherapy is a skill you're going to use here. It's not the only skill. To anyone who comes new into FCP or looking to join FCP and want to know what FCP is, you're targeting the main problem rather than the symptoms. I would say FCP is like a Sherlock Holmes.
What are the treatments they have had so far? How important these skills are?
Appendicitis, cancers, are you aware of them? This doesn't look like MSK. I'm so scared for her and the two daughters because I can see her future.
Treat a person as a person, not as a patient.
And when you come to a GP surgery, it's a primary care.
And many of the time I feel physios are poor communicators. Don't just practice your physiotherapy skills. That's one aspect of your skill. Thank you for joining me on Keep It Moving podcast. Today I have another amazing guest. She is a physiotherapist, but she slowly climbed up the ladder to become a leader and developing other physiotherapists to deliver amazing service in the GP services or GP surgeries. And we're going to have a conversation about what is first contact practitioner role means. If you're a physiotherapist watching it, how you could do a better service or better job in the GP surgeries, and how to get the best out of it. And this is all about how a smaller, level physiotherapist slowly grow up the ladder and became a leader in a physiotherapist journey. And it's a great conversation. Let's dive into it. Namrata, what a pleasure to have you on this podcast today.
It's a pleasure to be here.
Thank you for joining us today. The conversation we want to have today is all about a role of physiotherapist in primary care, that is GP practices across the country. And this message goes to all the physiotherapists who are working in GP practices. Amazing people, amazing physios. They're doing a great job. But you have done something extraordinary, turning around team of physios as a very highly skilled first contact practitioners. We want to know the secret behind it. How did you do it? And at the same time, people watching it at home or while running, listening to it, and they need to understand what is the role of this first contact physios in their GP practices, so that they can understand more about their roles and responsibilities and get the best out from the physios. So the message goes to the wider public, so they get the best out of the physios. That's all the conversation we want to have. So firstly, how did you get here though?
Long story shortly.
No, keep it as long as possible because I know the story. Amazing story it was.
So I came to the UK in 2018 looking to get into masters and doing masters in Glasgow University. I finished my 1 year there and I was looking for opportunity to be a physiotherapist in the United Kingdom. So, which made me decide to move down to England from Scotland. And luckily...
Needless to say that Scotland is your favorite place, right?
Yes, always has a special place in my heart. And also for my brother as well, who was coming in here. And luckily I got a good job working as a physiotherapist for a care home or a nursing home, which gave me a good scope to know how that system works as well, which was something unique and new to me as well, because I was not sure how we can help, although we did do the geriatric population, but then how I can fit into the role.
Yes.
I think according to me, I went way beyond what I was supposed to do. I was supposed to give physiotherapy and help them, but I went into care plans, moving and handling care plans, a lot of other care plans, which was not my role entitlement.
Yes.
But because I was interested and I thought, why not? Let's help people because they are struggling. So that made me realize about care plans, how we can help wider population as well, which was to a limited scope, and there was no other scope from there. So then I thought, let's see what else we can try. When one of my a friend though,
yes,
who suggested me about Excel Health, which on my knowledge I did apply, I think few months before I got the job. But then on persistent, I think the next time I was like, do we still have any roles for myself? And then that's when I got the role for Excel Health. When I came into the role, I actually wasn't sure what the role was because I only knew about private practice.
Yes.
But always I take anything that comes to me as a nice challenge, and whatever I would get, I would learn from it. So even with the care home one, I was not sure what I'm doing. But I was like, it's a good opportunity. Something I will surely learn from this.
But there are two things in your DNA here. One, attitude to help others. But again, you've been to university, masters and undergraduates where you knew the physiotherapy world in and out. But you were customizing to the need of the population you are serving.
That's right. That's one thing as well. Where I thought, I always have this thing in my mind is whatever you've been taught.
Yes.
It's like the ingredients you have in your kitchen. Depending on if you want to make, pulao or lasagna, you would select those things and then make it. So when we go through university, we go through masters, we do not get to learn what to do with lasagna. We get to learn the ingredients.
Yes.
It's on us how we use them. Do we make a good dish out of it, or it's just something crap that is coming out?
But these cookery skills, the universities don't teach us, isn't it? How to apply the knowledge we gain from universities and put it into the right place and get the best dinner out of it.
I think it's all about flexibility as well of the therapist. They should be flexible enough to then judge if what theoretically I have been taught, is that going to be correct for the practical
Yes.
thing? But I think that's where a lot of people mess it up because they're so into no, in this book, this page, this line, I've been taught I have to do this. I'm going to follow this depending on if it's going to help the patient or not.
This is called adaptability.
Yes.
This is, I can't remember the footballer we met in Tottenham Hotspur Stadium when we went on a conference. That reminded me just a couple of days ago, Bruno. And he was a footballer in Liverpool. Football club. Before that, he was playing in Watford. So Watford, he was playing completely different role. Then when he went to Liverpool, he has to adapt so much as per the manager's instruction. And again, he will be asked to play in various positions. One day he'll be a defender, next day he'll be attacker. Yes, midfielder many times. And he said, my job is to achieve the goal the manager sets, and at the same time I need to enjoy the game.
That's true. That is very true.
That adaptability comes with experience, and not many people understand.
And also the willingness to do it.
Exactly that.
I mean, if you're not willing...
That is not there in many...
Yeah, you can have 100 years of experience, but you're not willing to do it, then there's no point.
Willing to change. Yep, that is the point.
So then when I came to Excel Health, again, I have no idea what FCP is, but I adapted to the role. I came to know the role a bit better as I started working. This I'm talking about, I think, 3 years.
3.5 years.
Yeah, 3 years. Yeah, close to that. And I think opportunities came to me because I think I was ready for it, one thing.
Yes.
And I was happy with what I was doing and I was enjoying the job. That is one thing I feel, because I don't remember coming to my managers asking, what is the next role? What is the next role? Where am I going here? I have no idea. It just came to me. I think it was the right opportunity, right place, right time, and right skills that I could portray as well. I could have it, but if I'm not able to show them also, it's a bit challenging.
When you joined us, we were a very small team. Do you remember?
I do remember.
And very, very small team. We would just get going as a FCP provider, even though we had few other contracts in Kent. But at the same time, we were slowly moving up to North Kent areas. And your interview happened
in a nursing home. Oh my God! I do remember there was a phone call before that.
Yes.
And I still remember. I think it was about shoulder problem.
Yes, that's right.
And I was like, oh my God, I have no idea, because when you work in a nursing home, you do not actually look into physio point of view. You just look what you have and how you can help. So you don't look into needs test, Hawking Kennedy test to know what's going on. I was like, oh my God, my knowledge from Manipal should actually work here, or else I'm not gonna get it.
So your interview was kind of unconventional. We were in the nursing home. We went to see a client there, and we sat there and talking for 2 hours minimum.
Yeah, in the car park.
Quite a long time. Car park. We sat there and talking. I clearly remember you saying, Scotland is your favorite place to live, and you said, Xavier, if you could get me a contract in Scotland, I would happily live and work there. I was saying, is she weird or something? Are you weird to have, go to Scotland in colder part of the world? And I was thinking, okay, that's fine. Then we did talk about your PhD ambition, doing in dance and everything. It's a fantastic journey. And if you compare yourself from there to where you are today, it's amazing growth you have had.
Yes, amazing growth thanks to you, thanks to a lot of people in the company.
Honestly, and you had an amazing mentor, Karthi. We should mention him here.
Yes.
And you both were amazing bunch of people. And
Actually, again with the mentorship as well, you should be able to work with them well. If there's like a bit of prejudice, like, oh, he's gonna judge me, she's gonna judge me, it's not gonna help. Like with me, with you as well, and with Karthi, never felt like, oh my god, they're gonna think I don't know about this, I don't know about that. But it's always like a helping. That's fine, yeah, understandable, but yeah, let's look at it this way and let's go from here. And that is, I think, one of the attitude you would need as
it.
well.
And I felt, by seeing you, the way you have grown, few things I'll take away from your experience here is adaptability, willingness to learn and change, and go with the flow, and always, have the desire to help your colleagues, your patient group, and the surgeries where you're working. People, if you're a physiotherapist watching this or listening this while you're running or in the gym, please take away this message. The opportunities in first contact practitioner role never be presented to you. You need to take it out and learn out of this. And I've seen hundreds of FCPs have done an amazing job, but they stagnated in one level. They haven't progressed up.
I think it's because they get adjusted and used to and familiar with it. No one likes change. So if you get used to it, you're like, things are working nice, well for me.
Complacency, nothing else.
Why would I look for a change and challenge myself? I'm nice, relaxed, enjoying. So let me be there. I think that is one of the challenge as well. You have to come across and you need to be like, do I want to go with the challenge or I'm okay where I am?
Yes. Complacency is a killer of skill growth. Complacency, I hate that word, but lots of us are. Just happy where we are. We don't want to change. But at the same time, we can't expect more if we have the same mindset. That's called the growth mindset and the fixed mindset and everything. Now, I need to, get you a few important questions. If I'm a physiotherapist, I want to do amazingly well in a first contact role, in a GP practice or in a primary care network. What are the skill set I need to develop?
So, I would say to anyone who comes new into FCP or looking to join FCP and want to know what FCP is I would say your physiotherapy is a skill you're going to use here. It's not the only skill.
That's true.
So the anatomy, the physiology, the pharmacology that you've learned in your bachelor's, perhaps in your master's as well, you've mastered those skills. You need to use them more. So that's the confusion I've seen with a lot of people who come for mentoring or as a mentee to me.
Yes.
They come with the mindset, okay, I'm going to do physiotherapy. I'm going to do active ranges, manipulations. Yes, that one of the ways. But then when you come to a GP surgery, it's a primary care. That means patients do not know what they're doing. Don't know why they are here, to be very honest.
Yeah, that is true.
That is very thing. They will be like, I thought I was seeing a general practitioner, a doctor. Okay, how do you help me? Some patients are very happy because they're like, oh, physiotherapy, perfect. Shoulder problem, I'm the right place. But then you need to have a skill set in a way that you look at them and you take a holistic approach. So if a patient comes in with shoulder issues, I'm not looking at the shoulder.
Yes.
I'm looking at their age.
Yes.
I'm looking at what job are they doing.
Yes.
Is that going to be a problem here? Any family issues, related problems, past problems do they have? Stress. Cannot stress on this more than I can, but stress becomes, I have seen, major factor in many musculoskeletal issues because your mind is overrunning, the body is trying to help and it just overruns, the body overruns, and then that can cause musculoskeletal issues. And I think that is major factor where a lot of us including everyone, perhaps in the GP practice as well, we miss it out and we keep targeting shoulder problem, give pain medications, do some exercise. But what is it? Where is it coming from?
That's true.
That is, if we have someone to look into where is it coming from, I think the tertiary care and stuff will slowly slow down and it will only remain in a primary care because we are targeting the main problem rather than the symptoms.
In a local area.
Yes.
So what you're trying to say here is as a physiotherapist, you need to look at the holistic view of a person and look for the source of the problem, don't just practice your physiotherapy skills. That's one aspect of your skill, but look at the holistic view,
That's
full, and treat a person as a person, not as a patient.
I mean, I would say FCP is like a Sherlock Holmes. If you like detective work, this is the right job for you. But if you feel like, no, I want to treat people, then I would say you need to then stick to physiotherapy, private practice, treating them. But if you are like me, who loves to kind of solve mysteries, like why is this pain there still?
That's a very nice way of putting it, Sherlock Holmes.
Yes. If you are a Sherlock Holmes in a physiotherapy background, FCP
This is the
role
job
for you.
What are the other skills they need to develop, or they should brush up more before they take on this kind of role?
So pharmacology, so the effects of what medicines they are taking, is that causing any issues? Psychological aspects, job aspects, posture, work environment. I mean, it's a long list, to be honest. But yes, your basic skills would be your physiology, anatomy. To know pathology is very important here, because there are so many other things can cause a shoulder or a hip problem. So are you quite knowledgeable about your pathology? Do you know not just tendinopathy, tendinitis, but how about appendicitis, cancers? Are you aware of them? Do you know how they represent? Do you know how, if this looks not similar to a shoulder pain, this looks something else, are you able to catch them?
Differential diagnosis, most important.
And not just, again, differential diagnosis, a lot of people can still look into being mechanical low back pain, acute low back pain, chronic low back. No, you need to go out of it. What else? There's a gut issue. Do they have gut problems? Kidney problems. Do they have a kidney issue? Ovary, gynecological problem. Is that something going on? So widening there also, not just differential diagnosis
within
in
the musculoskeletal.
No, it has to be in general.
Well out of their
whole
scope.
Body.
Yes.
Whole body, if you can look into, and that is also a skill you need to know, because yes, there will be patients who will come with frozen shoulders and osteoarthritis, but they're going to be, I would say, 30% of the patients with no clue. Not you would have no clue.
Yes.
Doctors will have no clue. Patient will have no clue. So do you run your mind to your very basics to know, okay, this doesn't look like MSK, first of all.
Yep.
Does it look like renal? No. Does it look like gastro? No. It looks like neuro. Then you can guide yourself, because you're very thorough with your
examination.
Basics.
Oh, yeah.
Basics. Going into anatomy, physiology.
Wow.
If you're not as good in your basics, it is difficult game. Because then you're looking into only active movements, passive movements, and doesn't work out that way.
Lots of us as a physiotherapist, we are happy with our physiotherapy techniques, but we don't collaborate with the medications patients are using, or they've been prescribed long time ago, but they are not using it appropriately. How important for a physio to, first of all, look at the summary of the patient ill healths, then look at the summary of the medications. What are the treatments they have had so far? How important these skills are?
I mean, the basic thing is, if you know these things, you would come to know how resilient the patient is as well. You would know if the patient actually trusts medicine.
Yeah.
Sometimes they've taken 100 medications. They're like, I don't trust the medications. Why would I trust you?
Yes.
So that will give a good knowledge, and also it will make you understand about the patient well. Again, holistic approach you're looking into to know if the patient actually understands, first of all, what they are having. Do they have enough knowledge or the mind space to attract what we are saying and then work on it? Or do they, like, everyone is going to say, I have low back pain, you take medicines, take 2 days rest, and then go back to work. I can't work. So lot of aspects you will come to know with it. Medications, if anything is affecting this. So there is statins, I have heard, that can cause a lot of musculoskeletal issues. So are you a bit aware? Are the patient just started taking it? So there's a high likelihood. So would you be able to communicate that with the patient? You just taken statins. This could be because of it as well. Rather than just putting, you're old, osteoarthritis is going to happen, you have to live with it. Again, there is a different way to put it as well. You can live with it.
Yes.
I have heard patients coming to me saying that, what can you do? I've heard from a consultant saying that you have to live with this. So now I have actually turned patient around saying, you don't have to live with it.
Live with.
So when we say you have to live with it, it's a different concept completely. You have to live with the issue, but not the pain. It's just the issue, it's not the pain.
That's a very beautiful way of thinking,
Like
isn't
for
it?
example, osteoarthritis. People just keep throwing it around. Okay, shoulder pain, osteoarthritis, knee pain, osteoarthritis. And then everyone has a mindset, I have to live with this.
Yes.
I have to live with this pain. But it's not right. You don't have to live with the pain. If you know what it is, you know how to deal with it. You know you're going to have ups and downs with it.
Of course.
So if you know what my plan is, if I have like a bad day, what my plan is, if I have like a good day.
Yes.
So then you can manage it, let's say until 100 or until
110?
you pass to the other side of the world. But then I think that knowledge with clinicians as well as the patients is missing. That's where a lot of patients go into depression as well, because they have to live with this. Now,
Yes.
there's no motivation. I used to be a runner. Now they tell me because I have knee pain, I should
We
not
shouldn't
run.
be running.
But come on. I mean, I've also heard a lot of people saying that running is the bad thing you can do for a knee.
Come on, man.
But where are you coming from is the
Yeah.
first question. Like, okay, I don't have any strength in my knee. I'm running. Yeah, perfect, bad thing. But if you're strong, you're taking care of your body well, it's like a machine.
It is. It will continue to run.
Yeah, but if you don't take care of your nice Ferrari, you can't expect it to run.
That's a beautiful way of putting it. This communication, and many of the time I feel physios are poor communicators. Saying that, and not only physios, I would say, doctors and also consultants in the orthopedic world, they'll say that your spine is crumbling. You need to put up with it. You need to learn to live with it. These are all very wrong words to use, isn't it?
I mean, yes and no. I mean, in a way, yes, in the sense, I think because they don't have time. So whatever is easy, okay, you have a spine issue, it's crumbling, live with it, okay, next. Because time is a challenge. I would say we are privileged in a way. We get 20 to 30 minutes. 30 minutes. So if you manage your time well, you can get like 5 to 10 minutes just to discuss these things. And I think sometimes the whole therapy, if we talk about, is just in that 10 minutes you speak.
That's true. That's true.
If you speak it quite well, they take the important points and they are very satisfied with the session. They might be like, I want to come back and see you again. Why? Even if I'm good, just to say, it was so helpful. I think yesterday I had a patient who was, I think, 88-year-old female. She came in with the sandals and she was complaining of her foot pain. I was like, first thing we need to do is change those footwears. It's not right. She came back just to tell me, I took your advice. I'm wearing these shoes. I have no foot pain. I'm doing a bit of exercise but I'm enjoying my life.
That's it.
She was a person who used to love wearing heels, and like 88-year-old female. Still fashion.
Enjoying life.
Yeah, but then she's like, these kind of education, if you would have got, let's say when I was 20, I would have protected myself so much. At least now you guys are giving us, so that's good. I'm learning and following.
I take your point about time factor, isn't it? GPs do, poor guys, they get 10 minutes for a consultation. Orthopedic surgeons will always run 2 hours late, and they need to catch up before they get out of the room. It is very hard. But again, when I was working in the GP surgeries for a few months, and many patients say that when the doctor said, I have a crumbling spine, they straight away compared to the brick which crumbles on the bottom end of the wall outside of their house. They believe that this brick is crumbling and the whole house is going to collapse. The same way my spine is crumbling, I'm going to be ending up in a wheelchair.
Or not able to lift my finger or a toe up.
That's true. That fear factor plays a major role, isn't it?
Yes, so that it becomes difficult because sometimes when it comes from a consultant, which is a big
top of
title,
the tree, I would say.
Yes.
Yeah.
So if I put it as mere physiotherapist down on the bottom, if we try and explain, some people, yes, take it because they trust the physiotherapist, or basically they trust you.
That's true. As a person.
As a person.
As a clinician, yes.
Some might not take it and stick to that point to, they said it, that is what is going to happen. And believe me or not, your body will listen to what you say.
That's true.
Your
what
mind
you tell yourself, that is imprinted in your brain.
So if you keep saying, doctor told me I'm going to be like this, I'm going to not be able to walk, your mind will be like, that's what we want. Perfect. We will do what it needs to be done.
Tony Robbins always says this: you are who you are, or what you think of all the time. You will be the person who you will be thinking about something all the time. If you think I'm bad in maths, you will be poor at maths. If you're going to say I'm not a good communicator, and you will never be a good communicator.
Because your then mind and your body will look for those things to then prove you right. Because that's what you want.
You are absolutely right there. The mind will prove you that that is the way.
That's what you want. We will give you that.
Another way, the quality of your life is your quality of your question. If you think, why am I in this trouble? The mind will get you more troubles on your way. How can I find a solution to this problem or a trouble? That finds a solution. What you ask, what you get.
It's true.
So communication is most important as a person, as a clinician, and as a physiotherapist in private practice. The next point, how important is understanding of blood tests, understanding of X-rays, MRI scans, as a person, as a physiotherapist, important to survive as a good FCP.
It's good to have these skills. I think you will develop with the job role as well, because as a physiotherapist, we ideally do not look into blood tests and MRI scans and stuff. But as you work with an FCP within the role, you would get those knowledge which will be really helpful, again, to get a good idea. Sometimes MRIs say something, patients say something, or experience something.
Yes.
So you will learn that aspect as well. Like when patients say, oh, the MRI is going to say it's crumbling spine. But it might say something else, and that could help the patient and help you to understand. I have seen that kind of discrepancies as well, where the patient is completely fine, no problem.
But the MRI gives you a completely different picture.
X-ray says advanced level of wear and tear changes, degenerative, look into orthopedic opinions.
Surgical opinion.
But the patient is walking, running,
Absolutely
happily,
normal.
jolly, no problem. So again, knowing these factors as well, that again, sticking to the point is not, and communicating and getting a mid-reference to both the parties, what the X-rays, blood tests are saying.
Means to the patient.
Yes, and what the patient says and feels is also
most
important.
important.
Yes, the blood test gives you a good idea about general overall what is going on. We don't kind of focus, or we were not taught to focus into it, but that's something of a skill that really helps to, again, go out of the box from an MSK.
Wow, that's good. When I used to work in the NHS world, and I never read the MRIs and the X-ray results before I spoke to the patient. When I did the same mistake of reading the MRI scan result before I called the patient in, I would be expecting an 88-year-old old man with a stick on their hand, cannot walk, possibly end up in a wheelchair in a few months, because the MRI tells you so much information. But here comes a young, active 88-year-old man, with the polo t-shirts and a beautiful way of living, and he says, can I climb the mountain, or I should not climb the mountain? That's the way people are. So never read the MRI scan result or X-rays before you see the patient.
Or never judge.
Exactly. Because the MRI tells you 100 different information. Out of that, only one may be the problem the patient wants you to address.
Relevant to the patient as well. I mean, there are so many accidental finds. We would not know what is an accident before we know what is actually happening.
Yes, that's true. And these are the amazing skills a physio need to develop if they want to work as a FCP in a GP practice or a primary care networks. And again, you would provide all those training during your mentorship time and everything.
Again, I think it's self-learn.
Okay.
There is so much a mentor or a supervisor can provide. So it's like I'm keeping a tray of sweets. Now it's on you. Would you like to eat it, or you have diabetes? You say I don't want to eat it. So we can provide everything. Knowledge, training, one-to-one sessions, speaking. But then if you do not take anything out of it, we can do it 100 to 100 hours.
And this never works.
Yeah.
And I've asked you the question before. What is the toughest patient you have seen as a first contact practitioner in a GP practice, or the way you carried out a consultation which saved that patient life?
I mean, just recently we had like a 50-year-old female who actually came with her 2 daughters. And the way she was presenting, I was like, this doesn't look like MSK. I'm so scared for her and the two daughters because I can see her future somehow.
Yes.
So, yes, going through that, it was difficult for me because I was not sure what extent do I tell the patient is what I was thinking.
Yes.
Because she was going through a lot of weight loss issues, other scans, MRI scans for her head. A lot of things were going on with her, with that both shoulders. So she can't sleep. So it becomes a difficult conversation to have with the patient. So you need to pick how much can you say, because obviously I'm not an oncologist. So I would not know if it is actually in fact a cancer. But
but you are suspecting that.
We were suspecting that. We're still suspecting. We don't know what is going to happen. But then I think that is in a way challenging for me to know. But the other challenge I've also seen is where I don't know what's happening and the patient doesn't know what's happening. I had a patient yesterday. Both of us have no idea. The doctors have no idea. I think the consultants perhaps might have some idea. But unusual symptoms, vibration in the body, some flu, loss of hearing. Then Bell's palsy suddenly in a summertime.
Wow.
So it's like giving everywhere. Everything is going on. And she came in for a neck pain. I was like, okay, that's correct. Okay, I understand what's going on with the neck. But the other things, pins and needles all over the body, it's not the neck causing it, I'm sure.
No.
So the neck now here is an accidental issue. Or perhaps other things causing the neck pain.
Or maybe tip of iceberg you are seeing.
Yes. So again, as an FCP, you should be able to catch that as well, or else you'll be like, no, this is neck. MSK is a problem. We'll set it. Yeah, that is there. But then is there something else going on? So that again, no, none of us know what's going on. So that's a different challenge to kind of get into. Not that I take it in a negative way.
No.
I always take it in a positively because I'm a Sherlock Holmes, because I want to know what's happening. Because I want to know what's happening because this is unique, something new to know. And I'm always excited with it. I think that is another challenge. The third challenge I would say would be incooperative and very demanding or
rude patients.
Rude patients. I didn't want to say that.
No, say that.
Where they come march in and they're like, okay, I'm not going to leave until, let's say,
I've been given this.
Yes, I want this, I want that. And I'm not leaving. I have the whole day anyways. I've taken off today and I'm going to sit here and, tell me. And then you don't have whole day to kind of sit with them. So that was a challenge which I think it worked out well with me. There was another challenge where the patient came, I don't know what I'm doing here. I don't want to see you, and walked back out. So
these other things are common, isn't it?
Very common.
Remember this way, when I was very young as a physiotherapist, the patients comes to us with a prescription of the diagnosis and the exercises given by the consultant. They tell you, oh, this patient has a lumbar spondylosis. Can you treat them with the mobility exercises and everything? It was quite convincing and easy. Just do what the consultant tells you. You don't need to take any accountability if the patient gets better or not. Now we're all very autonomous practitioners. We challenge everything. And we never get to have the diagnosis, as you say. That patient didn't know what is going on with them, and the doctors don't know what is going on. You are digging and finding out the diagnosis. It's quite satisfying
but that's
when you come to the right diagnosis.
But that's why if you know your basics, then you can I look it into a way like eliminating stuff. So it doesn't look like gastro, no. Renal, no. Obviously within my scope of knowledge. But then that gives a good satisfaction as well. You've kind of evaluated whatever can go wrong, and then you also don't know.
Yes.
I mean, it can be that obviously I'm not God, so would not know everything. I'd know some things and not, but it makes me feel good, like you know these things and you kind of eliminating and then coming to sort of a conclusion you think might be right for the patient.
Oh God, and these are the things you guys do it in 20-25 minutes, isn't it? Amazing skills. So now let me turn the table around and say, I'm a patient struggling with some kind of joint pain or muscle pain. I want to get the best advice from my doctor, but the doctors are always busy. Poor guys, they are sorting out various other problems. What should I do? Whom should I ask for?
So again, depends on the symptoms as well, I would say. When you come to the, let's say, doctor, receptionist, admin team as well, which points do they take?
Yes.
And then which points do they act on? I would say I have cough, flu, shoulder pain. They might say, oh, shoulder pain, FCP. Okay. But the cough flu could be the one that is actually troubling them. So, it would be good. That's why they generally say one problem at a time.
At a time.
In a way is good, but in a way is wrong as well. Because sometimes things are interlinked. So because you come with just shoulder pain, you might be having back pain, elbow pains, hip pains as well, which will give me a broader picture.
Yes.
Because you've been told only one problem, you might come only with the shoulder pains. So it is a bit difficult. I know for admin and receptionists who don't have medical knowledge, it's very challenging for them as well.
True.
I would suggest a physiotherapist sitting in reception once in a while so they would know, okay, this can go here, this can go there.
That will be a good exercise.
Yes, it will help the segregation and patient will have a good flow of treatment. Or else they're thrown to nurse is like, this is not for me. Thrown to the GP, MSK, not for me. FCP is the last one perhaps the patient sees, and by then things have gone
Carried
way
on
too
for
long. Yeah, so it's a difficult thing to know where to send. I think sometimes even the clinician would not know where exactly would I send this patient to. So we can't expect that from a receptionist and admin team, honestly. But they are doing a very amazing job as well.
I feel people at the GP surgeries are really, really amazing. And sometimes as a patient, we need to be polite and patient enough. Think that these guys are doing their job in a best of their abilities with the limited resources they have. The shortest resources or the limited resources they have is the time.
That is true.
And these guys are struggling. I would as a patient, I would ask for any professional. There are multiple professionals work in a GP practice like pharmacist, social prescriber, and paramedics, physiotherapist, healthcare assistants, podiatrist, and all these dietitians nowadays. And we have a few dietitians working in there. And all these people are creating amazing ecosystem of primary care. And the patients can get the best out of this person rather than not demanding that I need to see a doctor.
But the issue happens, I think, is the communication between them. With that patient, the patient might say, I have this, also this. Then it becomes very difficult and challenging for one person, let's say with 10 minutes of time, to address everything. Then it's a very difficult. A GP surgery is challenging for everyone. Patients included,
yes.
Admin, GPs itself, receptionist, everyone. It's challenging, but still people are struggling, but still strong.
This sounds like a war zone. You're going to a war. You don't know what's going to happen for a whole day.
There will be bombing. There will be nuclear power going on there, but then you can survive and come out. That is one thing for sure.
Oh my God. So let me talk about your mentoring style to your fellow colleagues. And I know you have upskilled so many physios as amazing first contact practitioners so far. They're all thriving very well. I could see that. If somebody comes to you as a mentee, what do you expect out of them, and how strict will you be?
Depends on person to person. Some people do not like that way of mentoring. Some people actually thrive with that. So first thing is, when they come in, for me to evaluate how much they know, how much they don't know, where they would need the help, and where they are okay to kind of go forward with. Strictness does help, but not always. It can go completely other way as well. So you need to be calm, and I think you need to match how the other person is. Sometimes mentees can be scared. So you can't be strict and be like, so everyone is scared. That doesn't mean you have to be scared. That's not the right approach. So your approach would keep changing. But then overall strictness is important. But depending on person and situation, I think you should kind of alter a bit to kind of help them, because we are mentoring them to help them help themselves. We are not here to lecture them.
You are enabling them to find what is in them so they can become a better person.
Yeah, give them that boost. So if they ask questions, this is my way of teaching. I would ask them 2 questions first. So let's say this is a case. I'm not sure what to do. It's like, what did you think? Where was your mind going? So I would know how their thinking processes. Are they taking these points into account, or they are just completely lost the plot? So then you can help them. Okay, did you think of this? Let them open their mind.
Yeah.
Yes, I thought about that. And what else can you think with that? And let them find the solutions themselves. I feel as if we give them the solution, no one's going to learn.
That's true.
And yes, for some people, they are not here to learn. Some people are here to get the solution and get out of the hole. But some people are here to learn, enhance themselves. So this methodology, I feel, would really work with them, where they ask a question, but then you kind of help them to think wider within themselves. And then if they're still struggling, yes, you can give them the answer.
Give them the
and then they will actually remember that for a long time. And
so
they will
you're teaching them to fish rather than giving them the fish, actually.
Yes.
So it's personalized training. That's absolutely fine. Now, let me put you on a personalized question to you. If happen to be, you are in, not even just after your A level, you are deciding which career you need to take.
Okay.
Would you still take a physiotherapy route, or you would have changed? I want to be an engineer.
No, I would not have changed. I always wanted to be in a medical field. But which one? That was a question. So thanks to my mother, both of us know, me and my mother, I'm not that great or studious to be a MBBS or the doctor level
degrees.
ones.
Okay.
But good enough to continue my work, and good enough in a way caring and wanting to help people. So my mother was the one who came up with the idea of physiotherapy. I had no idea about it.
Yeah, honestly. But we didn't have much of this information when we were very young, right?
So she just said, this is something, think about it. If you think that's right, we have someone who actually works as a physiotherapist. We can go see her clinic and see if that's what you like to do, and we can continue from there. And I would not change. The only aspect I would change is, yes, I'll go into a bit more dancing of things as well, where I can help mostly preventing injuries rather than treating. I believe in prevention than treatment.
Of course, that is the role of the physiotherapist.
Sort of, I would say.
Still, you got lots of time. You could pursue that and do your PhD and doctorate in it and help out people. Now, this is a quick questions. What is that called? A quick fire round.
Rapid fire round.
Rapid fire round.
Yes.
And I'll ask you a couple of questions. You throw the word comes to your head straight away. Okay? Don't think too much. Don't process it.
I'll try.
Where will be your favorite holiday destination? Switzerland. Which part of Switzerland?
Alps mainly.
Wow.
Mountain.
We've been to Switzerland many times, and Interlaken and what's the other place name? Lausanne is my favorite place. Oh my God, so many times. We spent so many good times there.
I can go once, that will be good.
Try it. Interlaken is an amazing place where Alps, you will go all the way up and down. Lausanne is another beautiful place.
Okay.
We want to retire there before. Then we thought we saw Scotland. We loved Scotland again.
Sure.
Now we are settled down to Wales. We love Wales.
Wales also is good, yes.
Quite adventurous place. What's your favorite cuisine or dinner items? What would you like to eat?
Indian. I would prefer Indian mainly.
Really?
But, yeah, that will be shocking to my parents, but still. Like, you don't eat any Indian food. I do.
So they think you're fully westernized.
Yeah, pizzas and pastas. But no, I do eat Indian. I love, that's the comfort food actually.
And it's quite emotional food as well, isn't it? Mixed with love and everything. Too much of spice sometimes.
You can balance if you're making it yourself.
And who's your favorite author?
I'm not a person to read books much.
Oh, really?
No. I gain knowledge by, especially speaking to my mother. She goes through a lot of, I know Louis Hay, but I have not read the books. But again,
but you have lots of conversation about it.
Speaking about it, going through a lot of conversations is how I learn. Not much of a reader actually, but that's whatever I know about psychology, medicine. Mainly, I gather from TV series, believe me or not.
Lots of Sherlock Holmes?
Yes, I actually gathered a lot of information, not the one that they portray, but then going back, reading on it. I've gained like from Dr. House, Grey's Anatomy.
Yes.
I've watched so many, but I don't watch it for the drama. I watch it what I can catch from there and help myself.
There's another good series I would recommend is A Good Doctor. Sean is amazing character there, amazing.
I think House I was watching when I was giving physiology exams. And I didn't study much, but just because what he explained, I wrote everything down there perfectly nice, and it was a good exam. I got a good result.
Children loved the story, and I hope one of them becomes a doctor.
Yes, hopefully.
Thank you very much for your time. It's lovely to catch up with you. And again, it'll be insightful for the physios who want to become a first contact practitioner in a GP surgery, or the patients. They'll understand more about what we do in the doctor surgery, and they can get the best out of the physios as well. Thank you.
No problem. It was nice talking to you today.
Thank you. Welcome.